Hi there, I'm Cameron. This is my presentation for my history project, and I titled it Mortuae Vivos Docent. This is a Latin phrase, and it translates to the dead teach the living, and I thought that really embodied what my project was about, and I think it's a really true statement that over the years, the dead have really taught the living, and that's the way we've been able to advance medicine as far as we have. Um, I believe that it's important for any funeral professional to know about autopsies and how they work and why they work. And I think, especially for a funeral director that's working with a family, they have that knowledge, so they can reassure a family that might be a little bit confused about an autopsy, or they might be confused why an autopsy is happening. And I believe it's up to the funeral director or whoever's working with the family. They have that responsibility to reassure the family that their loved one is in good hands and it's not a bad thing. I think it's also important for an embalmer to know if a postmortem has happened or if one needs to be done, and if they see some strange marks on a body that look kind of out of place or out of the ordinary, they can notify a coroner or notify law enforcement, and they can come in and take a look at it, and they can decide whether an autopsy needs to be performed, and that might save a lot of trouble, and it might save some time for law enforcement. So that can be good, and also it would be good if the embalmer could discover those marks before they start embalming them, because there's a lot of things that an autopsy depends on that embalming kind of takes away, like toxicology reports or flesh tissue reports. Fresh tissue, not flesh. An autopsy can have an impact on the funeral industry. Sometimes there's a lengthy investigation, and it could make the family a little bit anxious. They don't understand why it's taking so long, and again, it's the funeral director's responsibility to reassure the family that everything is taken care of and everything is all right. And a lengthy investigation might also prolong when a service happens. Say if a service was planned to happen a week in advance, and the law enforcement comes in and says, we're going to need to extend this investigation for a few more weeks, then that might change the service of when they have the funeral for their loved one. And this also may affect if, say, there's poor planning. I know it happens sometimes where they don't plan something correctly, and this lengthy investigation may delay funeral services for other families, and that could become a big problem. That's the type of snowball that we don't want to get into, because that would be really bad. Another thing that might not necessarily delay, but it might change the process a little bit of for an embalmer. They may need to make a little bit more cosmetic fixes to a body that's been dissected against one opposed to one that hasn't been dissected. And this is some of the examples of a cosmetic fix that they may have to make. Is this incision in particular is the one that they make to remove the brain. And this one, it starts behind the ear and it goes across the occipital portion of the head back around to the other ear. And if they're having an open casket funeral for this individual, they may need to cover that incision behind the ear, because it might be seen by the family if they don't have hair, or if their ears stick out a little more than normal. This might be seen, so they might want to use some wax or some sort of concealer to cover up those incision wounds. Another example of a cosmetic fix that an embalmer might have to make, this is the incisions that they do to open the chest cavity. These two incisions are the most common of the two. There are some variations between these two, but these are the most common. And the most common of these two is the Y incision. And this one, it starts at the two clavicles and it goes to the sternum and then down to the groin. This one I wouldn't see there being a problem in concealing, because normal clothes usually cover that area of the shoulders. So this one I don't see there would be very much of a problem, but there may be depending on what clothing the individual is wearing if it's an open casket funeral. And the other one that I would see there being more of a problem in concealing the wounds would be the eye incision. And this goes from the base of the chin all the way to the groin. And this one would probably definitely need to be concealed because they start at the chin, go down the neck, and you'd obviously want to cover those wounds just to make sure that the family doesn't see those openings. These incisions may have to be concealed, and the neck may have to be reshaped to make it look normal, like it hasn't just been cut open. The time periods that I discussed in my essay, the one that I started with was around 300 BCE, and this was when the first post-mortem dissection was performed purely for medical reasons or pathological reasons. It wasn't a religious ritual, and it wasn't for fun. And two men who did it were Alexandrian physicians, and their names were Herophilus and Erasistratus. And along with those two men, around this time period, there was Galen of Pergamum, and he was really the first one who was able to link physical symptoms that a patient was voicing to things that were happening inside the body. So he was linking symptoms to real illnesses. And then between 300 BCE and around the Renaissance time, it was the Middle Ages, and this was a pretty dark time for everything. There wasn't really any advancements in any science or art or religion or literature or anything. So that was a pretty dark time. And then when the Renaissance hit, it was around 1300 to 1600, and a couple of the people who made advancements in the medical field were Andreas Vesalius and Giovanni Morgagni. And like I said, the Renaissance was a rebirth for everything. So the advancements were pretty huge in this time. And these two men really paved the way for medicine as we know it today. And then we get into the late 1700s to the 1800s, and we have Karl von Rokitansky, and he made a pretty big impact on the forensic pathology world. And the first person that we're going to talk about is Karl von Rokitansky. He was born in 1806 and he passed away in 1878. For most of his life, he specialized in gross anatomy, but near when his career got more advanced, he focused more on pathology. And like I said, he made a lot of advancements in the pathology field. And one of the big things he did, he developed a technique that we still use today in autopsies, and it's the removal of organs en masse, which means as one unit. And once he removed all of the organs, he subdivided them into other smaller sections like the cervical, the thoracic, abdominal, and pelvic, and maybe smaller from there, depending on the pathologist. And he also discovered a lot of diseases that we deal with today, like endometriosis, endocarditis, and pulmonary emphysema. And he discovered these when he was studying or he was refining his studies in pathology. Giovanni Morgagni, he was born in 1682 and passed away in 1771. And he was really known as the father of pathology. He actually developed a book called something in Latin. I'm not going to try to pronounce it, but it translates to On the Seats and Causes of Diseases as Investigated by Anatomy, and he published this in 1761. And in this book, he goes over detailed descriptions of over 700 dissections that he did himself of several different types of bodies, and this is a very in-depth work that he did, and that's obviously why he's called the father of pathology. Andreas Vesalius, he was born in 1514 and he passed away in 1564. He also published a series of books, a series of 7 books. There's a Latin title that I'm not going to try to pronounce again. but this translated to the 7 books on the structure of the human body, and he published it in 1543. And in his studies, he discovered that humans are anatomically very similar to certain animals. And he actually disproved a lot of theories of Galen of Pergamum, because in the time of Galen of Pergamum, it was the time of the Roman Catholic and the Roman Catholic religion. And during this time, it was prohibited that human dissections were performed, so he did a lot of his studies on animals, and a lot of his theories were actually wrong because of his studying on animals, and Vesalius actually came to disprove all of these things. And a couple interesting historical figures, a couple renowned Renaissance artists, Leonardo da Vinci and Michelangelo. They also dissected several human bodies to improve their skills as artists. They did it to improve their work, to figure out the small details and the small features of the human body. So I thought that was interesting. And that's it.